Okay. So we have later this week, the Institute for Principal Studies is holding their Civic Summit, formerly called First Look, and that's live and in person, but they don't have the streaming set up. They were before they had it at the Independent Institute and they could manage the streaming better. So they'll be editing the videos and making them available. And I'll probably put an ad for it in the comment section where people can sign up to get those. Got a
Yeah.
series of speakers, and the quick overview point that's relevant for future sessions is I ran across five separate healthcare researchers with policy or research organizations who were homeschool debaters. And four of them had attended my economic thinking or fee workshops. Two of them are going to be at this program. Jonathan Wolfson's with the Cicero Institute, and his mother, Diana Wolfson, ran the Chicago Charge debate club for many years. And Jonathan was
Yeah.
my first workshop there years and years ago. And now he's famous and important and working on healthcare reforms, and he'll be speaking on that at the Civic Summit. The other is Maxford Nelson, who's with the Freedom Foundation in Olympia, Washington. And he's also going to be speaking in person at the summit, discussing some of his research and how the federal government is trying to use federal funds for healthcare to push people into unions to provide services that get federal funding. So he's been battling that at the state level, and he'll discuss that. And then there's three others, and hopefully they'll be guests just talking with us or with you about their research on healthcare. Lawson Manzel would be the first, we hope, who was with the Niskanen Institute, previously with the Milken Institute, and he'll talk about his research on patent thickets.
Yeah. And that looks like that's set up for next week to
Yeah.
record next week, early morning, my
Okay.
time. So 7:30 in the morning for me, I think. So that's,
Okay.
I'm looking forward to that.
Okay. Sounds good. The other interesting area, so I posted this morning on economic thinking and normal nutrition, and I'll have the links to those, an article titled Keep America Metabolically Healthy Again. This is a spin-off of the recent news of Robert F. Kennedy Jr. giving a presentation on the chronic health problems in America. And this was when he was uh, uh, wound down his campaign, put his support for Trump with the idea that Trump was going to support him in pushing this metabolic health or this health goal, which he describes in his research and interviews. And so their symbol, Make America Healthy Again, as an upbeat, positive adjunct to the Make America Great Again. And Casey and Callie Means are the key people in this. And their book, a new book was published recently, and we'll discuss that. But the argument is the current healthcare system, promoted by the federal government and mainstream standards, is mixed up on the advice it gives to people who are overweight, who are pre-diabetic or type 2 diabetic, or even cardiovascular disease, that they should focus on dietary changes, or at least in measuring your blood glucose levels. So you can see that if something you're eating or if high stress or lack of sleep is leading to blood glucose surges, which leads to insulin resistance, which leads to a whole network of chronic conditions. And in the status quo, they don't, it's not that they say that's not true, but they focus on other things instead. And to me, it's a fantastic area for students to debate, research and debate.
Yeah, yeah, and I know that they're, just the overall idea of healthcare. One of the things that I'm teaching my students is that there's a difference between healthcare as one word and health care when it's divided up into two words. Healthcare is more dealing with the overall industry that supplies. These are providers of healthcare and those types of things. Health care, in two words, is what you get when you go to the doctor, or when you visit a clinic, or if you have to have some procedure. You're getting care that is dealing with health, but it's provided by the healthcare industry. And so, yeah, I think that there is certainly room to be discussing preventative measures, especially through like dietary means and nutrition and things that the government has been pushing for a long time that we're finding out that maybe that wasn't the best thing for them to push. So
Right.
that's pretty crazy. And I was just reading this morning uh, that the Air Force, United States Air Force, has actually now met their recruiting goals for so far for this year of getting 24,000 new recruits. But the way that they did that was that they lowered the health standards for people who are signing up. And so they've increased the amount of the metabolic fat levels that new recruits have, and they increased it by like 5-6%, which is actually fairly significant that they're able to recruit now people who are more overweight that still qualify because the United States is becoming more and more overweight. And
Yeah.
the only way to actually get more recruits in is to allow for more overweight people to sign up to be recruited into the Air Force.
Interesting. I think of a quick response to that, which is that our planes are so powerful, pilots have been blacking out because they accelerate too fast. But with heavier pilots, they won't be able to accelerate as fast, and maybe they
Yeah.
won't black out as easily. I'm not sure students should use that, just my first
Yeah.
thought. Yeah, so these health standards, this follows from the federal dietary guidelines. And again, this is in debate. Some people say, well, look, it's not just carbohydrates, it's seed oils, vegetable oils that are inflammatory, or other things, plastics in the water. And so there's a healthy debate in that area about health. Your comment on healthcare and healthcare, I often see it as medical care and healthcare. That medical care is what doctors provide. They're medical doctors. Uh, but the current system doesn't emphasize their health. Uh, Now, you talk about the healthcare industry. Critics say, look, it's a sick care industry. It deals with people who are sick.
Yes.
And John Goodman is key on this. And I think we'll have you interview John Goodman. He's with the Goodman Institute. He was sort of the father of health savings accounts, medical savings accounts. And we're seeing a shift to direct primary care providers who are focused on your health because you only go to them. You pay a set amount to them every month, and they provide care 24/7 when you need it through their team of doctors, nurse practitioners, health coaches. But they're not the sort of people in the current system where you go in every time to an appointment and they can bill for every time they prescribe statins to lower cholesterol or metformin or insulin for people that are diabetic. They charge for that. Healthcare medical care companies make money on that, and it's the art critics say it's overwhelming our federal budget. Medicare and Medicaid are going to wipe out uh, the economy, critics say. Now,
Yeah.
just quickly, the good news on this, and this is the article I posted today, we'll put a link on, is looking at the Mariella Glant and the trial they're doing in New York City right now. The major Medicaid provider for New York City is doing a trial where people who have been waiting for treatment, who are type 2 diabetics and very poor health, they're instead put on a separate system with their choice to change their diet.
Yeah.
And they are being systematically deprescribed. They're losing lots of weight. They're getting metabolically healthy. So to me, this is a huge story for this year's debate topic, that the large number of people who are diabetic or pre-diabetic, estimated to be 50% of the entire population
Yeah.
by by some measures. If they change their diet, they can stabilize their blood glucose levels in days and reverse their type 2 diabetes, particularly if they've only been recently prescribed. And so this is not agreed. I mean, the current status quo does not think this is true or thinks it's only rare. But
Yeah.
so this is a big deal.
Yes, yes, it is. And as long as you haven't, permanently damaged your pancreas, I think you can bring things back. It's amazing how our bodies can restore and heal themselves. God created us to do that. And so we can do a certain amount of damage and then bring lots of things back if we start to change the things that have caused the damage. So if you, for instance, if you're hitting your hand with a hammer, and you stop, first of all, as long as you haven't done permanent damage, your hand will, start to heal itself. Even younger people, young kids, I'm amazed that, like with pediatricians, they're saying that, with a broken collarbone for a pediatric patient, if the collarbone is in the same room as the patient, it'll heal itself without a whole lot of intervention. And
Right.
so our bodies are amazing in their ability to heal themselves if we stop doing the things that are killing our bodies.
Yeah.
And so that, changing your nutrition, changing your diet, and that is something that we all need to be looking at, and that will help us out. Um, in regards to where the healthcare industry fits into that and what the federal government has over that's debatable. But I
Right.
think, it just to have a better life, we need to be doing things like that.